welcome to our first episode of Glasses Off with Rosa. Today we're going to discuss the impact of opioids in our society. But first, let me say a few words about our guest, Dr. Kapadia. Dr. Kapadia is an award-winning board-certified family physician focusing on mental health, weight management, addiction, and vitamin therapy. She graduated with Summa Cum Laude honors and has been recognized as one of the top doctors in the United States with more than 15 years of experience. Today, she will share with us her expert knowledge about the root cause of addiction to meds and how to prevent it. Also, Dr. Kapadia will provide some steps to stop addiction and guidance on how to help a loved one going through this challenging situation. So hello, Dr. Kapadia. How are you today?
I'm good. Good day to you, Rosa. And how's everyone doing out there?
Good, thank you. I am so happy that you had some time to share this space with me. So the first thing I would like to know is, why did you become a doctor?
Ooh, that's a very good story, actually. And I'm glad you asked me. I started my medical career, actually, when I graduated from college as a scientist. I was studying toxicology, where you take the medications that are eventually going to be used for treatment. And before we get to the humans, we do something called preclinical trials. So we put them into mice and see if they have any side effects. We put them into dogs and we see them into monkeys. Like, the hierarchy goes up before you put them into first human. While I was working there, I ended up rotating through Columbia University's dermatology because that's eventually the kind of field that I wanted to go into. And I ran into a patient. I personally have psoriasis, which are eczema-like patches that you can get on the elbows and other areas of your skin. This patient comes in and he is head to toe covered with really large, deep, red patches of plaques of psoriasis, and they itch and they're thick. They're from on his forehead all the way down into his anus and down to his toes. So he is in pain. And at the time, this is 2006, and there aren't many medications that are there for it. So he's participated in this preclinical trial for it. When he walks in, the first thing I notice is that his blood pressure is 180 over 101. Patient is morbidly obese, and he says, "Well, give me whatever you guys have. I'm just fed up with it. I'll take it." I go on to then talk to him, and then I joined something called National Psoriasis Foundation because I felt like maybe a lot of patients were feeling very dejected from what's going on with them when a medical condition like that takes over. So I started doing speeches about how patients need to take care of other aspects of their health, not just one part of medical condition is related to that pathology. So if you have a rash or a skin, it's also related to you having obesity or also not feeling well mentally. So this patient of mine, we ended up becoming good friends. And for sake of anonymity, I'll call him Steve. Steve and I became good friends. And over time, at the 2006, I started noticing that he was clinically very depressed. And because he was so depressed and feeling suicidal due to his insane amount of medical dermatological condition, he wasn't following with any of his medical doctors, especially primary care doctors. He wasn't taking care of his weight. He was not worried about his cholesterol. And he wasn't understanding the inflammation under his skin that was causing all of that. And he was clinically very depressed. So I thought, you know what? I need to change gears and I need to go into medicine. And I'm going to go into primary care and I'm going to concentrate in mental health so I can take care of all ailments from head to toe. And that's my story when I went to medical school.
Wow, that's so interesting. So, Dr. Kapadia, what I'm hearing is that people with general medical issues can get affected with an emotional reaction that may affect their judgment. Is that true?
Absolutely. You nailed it. It is the emotional health that is we're talking about today. That is mental health. Your emotional response on how to manage life, how to cope with stress, how to cope with medical stress, how to cope with the idea that you may be getting older or you may be developing some kind of conditions that you don't feel like are natural to you, or you're going to need medications for, or you're going to need to do something about it. And that emotional reaction, emotional cycle that you develop as a reaction to it then dictates how you're going to want to take care of your health. And it becomes a vicious cycle. That emotional mental health is then going to allow you to whether you become good at it or poor at it. And I think this is why mental health has become such a dear aspect of medical care for me when I take care of my patients in primary care. So you nailed it. Yes, emotional care, emotional health is your mental health.
And how often do you see patients addicted to medication?
Oh, wow. Okay, so that's even more complex when you talk about how often do I see patients becoming addicted. So, addiction is your brain's ability to require something in on chronic basis and requiring higher and higher doses of it in order to get the same response back. But I think when you talk about how often do I see patients who are addicted, the question becomes, do I see patients addicted who come in on Percocets? Absolutely. But then do I even see patients who come in and they're addicted to stuff that is not prescribed by doctors and that's happening way before they actually walked into a doctor's office? I'm talking about stuff like cough syrup, like pseudoephedrine, Tylenol PM. I mean, I have patients who are taking supplements over the counter that are highly addicted. I have a young male patient, maybe 22, who came in the other day and he's having heart palpitations and he feels it's anxiety and he needs a Xanax for it. And it turns out he's taking a pre-workout formulation at his gym that his personal trainer is giving him and it's crystallizing. So it has a little bit of steroids in them, kind of like a testosterone. And he's taking that in addition to like absurd amount of caffeine. Like what would be in probably like 8 cups of caffeine. He's taking that in one little scoop. And
Oh, wow.
and he can't come off of it obviously because he loves it. It pushes into this stimulatory phase. And then obviously then he's getting palpitations and then he can't sleep at night. So then in order to sleep at night, he's taking Tylenol PM on chronic basis. The liver enzymes are off. And here I am looking at him and I'm thinking to myself, where's this all beginning? And he turns out that, he had an abusive father growing up. He was bullied for being overweight. So this is something that's very dear to him. He can never go back to gaining weight. And his weight is so important to him that he has to take these excessive amounts to do excessive amount of workout. So you see right there, the pathology that starts all of his other issues like liver enzymes started way before with his addicted mind and maybe predisposed to that in his genetics and maybe psychological impacts that bullying might have had on him and his weight issues. But for him to come in here, and if I was just working for a normal practice that I used to work for, we as physicians have a lot of constraint on us. So I might have just, had 15 minutes to interview him and we would have never gotten to the root cause of what is starting all of this cycle. So do I see patients with addiction? Yes. And I see more and more of them since COVID.
Yes, I want to ask you something, and this is related. I read an article some time ago that was making reference that it can take up to 30 days for someone to get addicted, someone having pain medication. And I want to bring a story, something that happened to me many years ago, in which I had a surgery and there was something wrong. So I ended up in the emergency room and I was in so much pain that some of my internal organs stopped working. That's how so much pain I had at the time. I couldn't talk anymore. I couldn't express like feeling. It was really like just almost like I felt like just killing me inside. And the doctor, just to help me, they started giving me morphine intravenous when I was in the hospital. And I was having the morphine for 4 or 5 days.
Oh, wow.
After that, they sent me home, because they needed to manage the pain so then they can do the treatment to get to the root cause so I could get better. I understand all that. So they sent me with 2 controlled pain medication home that I was supposed to take for about a month. Something happened when I was on my way from the hospital to my home. I felt this intense need of being in the state of mind that I got used to when I was in the hospital, which was there was no pain and you almost was into living almost a virtual reality. And I remember during my commute having this craving, like really like a need of my body, that it wasn't at that point pain related, but most like my mind, like I really, really needed it. And I really have to make a great effort to basically not to take the medication that they gave me and just deal with the pain during that time and just have Tylenol, Advil until, eventually the pain went away. But I caught myself and I thought if I had continued with those pills, I would have become addicted. I don't know, it felt like the craving was very strong.
Yes. And you know what you're describing is called physiological dependence. And that takes over your mind. And that is absolutely true I mean, this is a very long prescription. 30 days is way too long. I think that nowadays, I really hope most of my colleagues are not giving more than out of emergency, any than more than a week for a maximum amount.
Okay.
And really, you should
That
not.
was
Yeah,
my question.
yes,
That was
you
my question
shouldn't.
because I thought 30 days, that was like way too long. And
No,
even though I
it's
saw
way
the
too long.
study,
As a matter of fact, now more and more, I mean, my colleagues and you guys should be, I mean, I want people to be aware of this too. Sometimes doctors were humans too. So if three patients before you ended up using profanity against a doctor who didn't want to give them for more than 2 days of medication, then by the time the third patient asked, we are humans, we can possibly only take so much. And then that also being said, there's really good doctors out there who won't give it to you because they understand this. And yes, there might be a few bad eggs, just like any other profession. But as a patient, for the fact that you immediately recognized that was great. And that's what I want most of my patients to. I want you guys to understand this. I want you to understand the fact that you recognize immediately that you were having these cravings. So your brain cells, addiction may run in your family. Your genetics may be different. It's kind of like cholesterol. When you come into my office and I say, "Hey, is there any heart disease in your family?" I also ask patients, "Hey, is there any addiction in your family?" And I notice sometimes people don't even understand what that means to say, "Hey, is there an addiction in your family?" That means you're more predisposed to being addicted to something than someone else. So you need to be aware of it. And absolutely, something beyond 3 to 7 days, something that strong, like morphine, Percocets, it's the same degree of medication as heroin. But what I'm seeing now, even increasingly, is that's an unfortunate experience that happened to you. But I am glad you're in a better place and I'm glad you caught yourself. Absolutely, absolutely. There's so many number of 3 to 10 agents one can take before you get to a controlled substance like Percocet or morphine. And there are patients who haven't wholeheartedly tried all of them. And I think that also maybe because there's such a broken barrier between physician and doctors and their patients, we are not having these conversations like in an ER setting, like ER setting that you were describing, which is mostly what the experience of a lot of patients is. At what point would you have a thorough discussion with the ER doctor about your 10 options? Because that would have required
okay.
another 1 to 2 hours. But I think that you're hitting it on the nail. I think that, we have to start looking at addiction as part of our medical history, our
Which
mental
is
health as
very
part of our medical
interesting,
history.
which I found interesting that you mentioned that because I think to most doctor I've been to, I don't think they ask about if there is any addiction in the family. So will you say that that is a sign, like if someone is going to a doctor that maybe is, I don't know, suggesting all this pain medication to look for signs or how to recognize if you're going to the right place or not?
Yes, absolutely. Absolutely. You should also, I mean, nowadays, I do think that people are very judicious and becoming more judicious. But yes, in my practice, always make sure that my relationship with my patients is very autonomous. Like I'm not paternal about what I want to give my patients. I want you guys to look it up. I want you to know about it. I want you to ask me questions before I give you something. Now, something like acute pain, for example, if you broke your foot or sprained your ankle, yes, patients should know the word like Percocet, morphine, fentanyl. These are very addictive medications. And, yes, that's a sign that you shouldn't be with that doctor. You should also make sure that you're seeing a doctor that is board certified. I think that there's a lot of misinformation out there. There's people who are calling and claiming themselves doctors and they're not doctors. There's people who are calling themselves nurses who are being supervised by doctors and a lot of times they're not. And these kind of things you guys should be aware of and you should be asking these questions. You should also ask your doctor when someone gives you the medication or they say, "I'm going to give you this," feel free to ask, like, is there an addiction potential for this? Am I going to crave more for this after my pain is resolved?
What about, let me ask you about marijuana. And the
Oh,
reason is I grew up in the Dominican Republic. And when I was growing up, even the word marijuana was almost like a bad word. I mean, it's considered a drug like any other drug. So
mhm.
that's how I see it. Now, I know that here in the United States, there is a different, I think, point of view. There are some people pro and some that don't like it. But I would like to know, what do you think of marijuana in terms of addiction and if it can have some bad effects or if it doesn't matter? What do you think?
Okay, so I'm excited that you asked me that question because yes, absolutely. I think medical marijuana. I mean, I am certified to prescribe medical marijuana. I do use that as one of the many tools offered to my patients for anxiety, for skeletal pain. But again, I think I put a clarification on that, who I think is appropriate for and who I don't think is appropriate for. I think even in the medical community, patients should know that doctors are very split about how they feel towards this. My mother is a practicing psychiatrist. My sister is a primary care occupational medicine. And I can tell you, even in the doctors, both wings are very split. My mother's anti it, my sister is pro it, and I sit somewhere in the middle of it. For example, if I see an 89-year-old female who's coming in with chronic pain, and she's saying to me that in the hospital they gave her Percocet and it doesn't feel her right, the daughter's not happy with it. I think she may be a really good candidate for trying medical marijuana to see how her pain does, especially for gummies that are very small amount of medication. Now, if you were a 15-year-old patient who came to me like I just had the other day, and it turns out that your mother tells me that you're taking Xanax that you're finding from the street, and now on top of that, you're using also recreational marijuana, and you're combining the two while you're driving or running errands. Now, that is extremely dangerous because the neurobiology of your brain when you are 15 or 16 is so significantly different, and so is your metabolism, than it is at 80. So, just you really have to keep the patient's full health, mental and medical health in mind when you are discussing anything with them, whether it's a supplement over the counter, whether it's a pre-workout, whether it's the caffeine, whether it's a prescription I'm giving you for like Prozac, or whether I'm giving you Cymbalta for pain or steroid injection or medical marijuana. I think these things are conversations that one should have with their doctor. I always want my patients to know, and I think most doctors want their patients to know, that we are not in the business to judge you. We're in the business to help you. So the more honest you are with us, the more we can give you informed decisions that we can both work on together. So medical marijuana, absolutely. I think nowadays, what I'm starting to worry about is that while I prescribe marijuana for fibromyalgia, patients who have like muscle pains, and my 40-year-olds who are extremely anxious, and they want something to go to sleep. Yes, it's one of the 10 stuff that I can give you, but it's not number one. So it's not too mild. It's not number two. It's not number three. Marijuana would be somewhere between number 5 and number 6. And then, of course, there's more stronger stuff up to 10. But I'm starting to worry about people getting recreational marijuana, and especially teenagers, when it's laced with stuff like fentanyl. Fentanyl is heroin, and morphine, the one that you were describing earlier. Now, when patients come to me and then say, "Oh, well, doc, I tried marijuana from the street and I am now just having intense cravings from it," I know immediately that that marijuana wasn't clean and pure. They're probably laced with something. So I think that just to even define it right there, I think the recreational versus medical is also an important matter to keep in mind. But nowadays, I even see patients getting Adderalls, from the street. And when I say from the street, it's not like a drug dealer that's down the street that you think about from like the movies. I'm talking about colleagues at work, people that you're on the Zoom call with,
Hmm.
people that you're actually going to work with. People get prescription medications that they're abusing without going to a doctor and having a conversation. And that's a whole different world of addiction that I think that really needs care for. And that's why I want to have this dialogue about mental health in primary care, because it is absolutely part of every other organ that's part of your body.
But in that case, when you mentioned that they're getting it maybe from coworkers or other people, they're getting it prescribed by a doctor, right?
Yes, and they're diverting it. And
Oh,
and of course the
so would,
responsibility.
so wouldn't the doctor know that this person maybe is not taking the medicine, or realize that maybe he shouldn't be giving that prescription to them?
Well, that is where the broken healthcare system enters the game. I get patients all the time. They're like, I can pull up some of the information. I'll say to a patient, "Oh, I know that you're taking Xanax from another doctor, or you're asking me for a diet pill that's controlled." And they'll say, "Well, how did you know?" Some patients bank on me not knowing. Other patients, they do come from another electronic healthcare system, and I may not be able to pull it because in the pharmacies, you're given an option to disclose information about your medications, and some pharmacies do not disclose it. So there's no way for us to have that without, I guess, contradicting HIPAA violations. One doctor's office cannot just share the information without your permission with another doctor. So what we know is coming from another doctor, or a patient is shopping around for doctors. We struggle with the other end. I struggle with patients who are going to like the 10 different doctors and getting controlled substances like Percocets. So there is a
Okay.
website that we can check in but it is still very difficult for us to do that. And again, if a doctor is giving it to somebody and who's diverting it, yes, I think the doctor should keep monitored. Like in my practice, I do not give any medication for more than a month. And I require my patients to come and follow up closely with me and blood, get blood work done. And that's how you would know. Because those are red flags for what kind of doctor
Okay.
you're looking for.
I always believe that our life is our responsibilities, each person's responsibility. What can they do to recognize if they could become addicted, and what can they do?
Okay. So first things first, I think that evaluate in your family history what kind of addictions do run. There's healthy addictions and there's unhealthy addictions. Take a look. Did you grow up with a grandpa who was having a scotch every day? And did you think his mood changed every time he had scotch versus when he didn't? Was he arguing? Was he cursing? Was he more abusive? Did you grow up with that? Did you think that was part of your normal upbringing? So that right there, even using alcohol, on a chronic basis like that is an addiction. So that becomes part of your history. So recognize those signs in you. Recognize, dysfunction. That's another thing too. I think when patients come to me and say, when do you think I need medication for my emotional or mental health? I say, well, is it impairing your ability to work at work? Or is it impairing your ability to communicate at home? Are you losing your patience with your young child and yelling at them and you can see yourself, you're out of control? So this is where impairment becomes. Recognize impairment in you. Recognize patterns that are making you feel out of control and come and discuss them with your doctor. Come and see where you're at. If you are in a hole already where, in unfortunate events, like I just saw a patient the other day who just came back from college and his dad has just recently passed away from overdose on cocaine. He had no idea his dad had that habit. He just looked like a normal family, ran a business, and patient is a younger, sibling who has autistic issues. So mom is really busy and he's in college. He comes back to me, says, I'm failing classes now because my dad just suddenly died and it was from drug abuse. And I think I need Adderall because I have ADHD and I can't concentrate. And I was very concerned about him because this is a patient who probably needs not Adderall. He needs something non-stimulatory in order to take care of his
Mhm.
concentration or but really before that, he needs to take care of his depression because his father just passed away. Is he taking care of his grief before he got there? So that's all part of your mental and medical health. And right there, I was telling him, I said, you have to recognize right now, knowing that your father passed away from overdosed on cocaine, addiction runs in your family, and brains of patients with history of addiction in their family, the neurobiology of your receptors in your brain are different than other people. It's kind of like when you say heart disease runs in your family. Well, the arteries in your heart and your lungs are designed differently. They're more prone to cholesterol. Just like that, the chemicals in your brain in addiction mind or addiction history in your family are more susceptible. So you have to be careful. I told him, I said, you have to be careful. Even when you go back and then you're exposed to marijuana or weed at school, you have to recognize that you are not the same as your roommate, given that you now know that your father passed away from cocaine overdose, because you are going to likely get addicted to this.
I find that really interesting, the fact learning about the family history. But for someone that is already addicted, and let's imagine that the person, I don't know, started with extreme pain, which is a story that I hear a lot.
Yes.
They started because they have a lot of pain. Maybe they're still in a lot of pain, but they would like to stop the addiction. What can they do? Like, how can you get out of an addiction that you're already there for a couple of
yes.
years?
Yes, great. And that's where addiction board certified doctors like me can come in place as well. And I think that is such a great question, because when you talk to a patient and someone's already there, if you know a loved one who's there, come and bring this up to physician's attention, because we absolutely have medications that can bind the receptors so you no longer can go to a medication that was making you addicted. For example, let's say heroin or fentanyl or morphine. Had you come to me after 30 days and now you tell me that you were having cravings and it's taking over your mind and your body, but you know that it's the right thing to do is come off morphine. So what I would have done is I would have said to you, hey, it's kind of like having a broken knee. Okay. Now I'm going to put you into crutches, which I'm going to give you a medication. So the crutches are going to be on for about 6 months or something. And then you're going to be off of it and you're going to be away from it. So for 6 months or 8 months, I can give you a medication that will not allow you to take morphine or Percocet. It
Oh,
will,
wow.
Yeah, it would make you literally like that binds the receptors, so your body would literally vomit it out. And the same thing with alcoholism too. If someone in your family is abusing alcohol, same thing. You can come to me and ask for those crutches. Ask me for your cane. Okay, I can give you softer medications for softer landing, and I can give you that treatment. So depending on how long you've been addicted to. So let's say, like, I have a patient the other day whose wife tells me that he's been combining his Percocets with alcohol past 3 years in COVID while he's been boxed in at home. Well, you know what? He's been doing it for 3 years. So I'm already setting your expectations. He's going to be under my treatment for at least a year. Okay. I'm going to give him crutches so he no longer can even do the Percocets. He cannot even drink on the amounts that he can because he would just vomit it out. And then he'll get behavior change and he'll get therapy while he's doing this so he can not have physical and such robust emotional cravings for stuff. So yes, there's medication like Suboxone out there. There's Subclade. There's Naltrexone. And for pain, there's Cymbalta. There's Prozac. Sometimes patients ask me, this is so interesting how my pain got better, but the medication you gave me was for my emotional health. Absolutely, because again, that's going back to that emotional and mental health and having addiction in your family. So yes, there are absolutely avenues for you to come off. And there's even programs out there.
That's great. What about in the case, though, that is a family, a loved one? So let's say in this case, and I know you mentioned loved ones, but that is a situation that is very painful, in which the person that has the problem doesn't think they have a problem. And they don't either have the strength or desire to get out. Is there a way? Is there anything you can do to help a loved one to at least try to get help?
Yes, absolutely. You can. Actually, a lot of my patients who are in the loop of addiction are usually brought on by family members. And this is something you can also ask your doctors, but you can also find doctors like me that do personalized mental health or medical health for you. So what I usually do is that my first interview session is, let's say you're a person who's worried about your aunt. So you want to bring your aunt to me and you say, you know what, she's kind of like not wanting to go to the doctors, and I know that she's doing these drugs and she doesn't want anybody to know. She doesn't want her to get out. She's not in a stage where she's even motivated enough to get out of there. So I say, okay, let me learn about them. Tell me about them. Like, what do they do? Like, give me feedback on what has happened in their life so I can understand that. And I spend that session just understanding what that patient is. And then the patient comes to me in terms of taking care of them in personal medical care and primary care. And I know how to then go around understanding the motivation or gauging where they are. What stage of motivation is this patient at? Are they in the, non-motivational, meaning like they are unaware of even that they have a problem, that they have pathology? Are they in the first phase where they kind of know that, their cigarette smoking is like 3 packs a day and they kind of know it's bad, but they're not interested? Or are they halfway through where they have attempted quitting, but then they keep coming back to it very aggressively? Or are they like very ready? And I think a doctor can assess that. You just have to have those sessions. And patients can actually use the appointments that they can make for their loved ones and use that time to just talk to the doctor for that.
Okay.
Yeah.
What about cost and insurance? Will this treatment be covered by most insurance?
So you know what? That is where I find my hands are often tied. I have my own practice, so I can kind of modulate how I want to play with insurance or not take insurance or play around with that. But I think a lot of patients don't understand is that we as doctors are often hired by bigger and more powerful companies and they have health insurance plans in place and they employ us and they'll give us slots of 15 minutes to see patients, and
Wow.
those are mandatory by health insurance. And if we don't, we all get in trouble. We get in trouble that we're spending too much time with our patients. And sometimes even the health insurance would deny the payment, saying that, you exceeded the amount and it's not justified. So I think that healthcare, and we should do another, you and I should do a conversation on that because it's very complex. I think patients only see their side. But doctors, we are frustrated. We want to give you guys personalized medicine. We want to give you personalized care. So there are doctors like me who broken up the model. I take in my balanced medical care, I take insurance, and then I will give you guys multiple appointments. This way we can spread out our sessions. And that's how we go around
Okay.
with the insurance. And then I can do personal concierge service, which is, you can pay out of pocket and we can do treatment. Maybe we could do one or two before we switch over to insurance.
Yeah, it is really sad to hear that because most likely there are many doctors that don't have their own practice. So they have to follow those 15 minutes rules, right?
Sure.
Otherwise, they could lose their job. And
Absolutely.
then I imagine being heartbroken because you really know what the patient need. You know how the patient could get better. But then because of all these regulations that you need to follow, then you really cannot do it.
No, it's just
So,
hard. This is breaking our spirit as doctors. Most of us all go into medicine because we have a good heart. We want to spend 10 years of training. It took me 12 years of training in school after high school to become a doctor. We all want to take care of you guys. We want to provide service and feel gratitude for that. And I think that health insurance is really changing that spirit of young doctors too. The system is so colluded. For example, in my practice, I offer vitamins therapies, because I think that my patients should have medications, prescriptions, but they should also have alternatives to vitamins. And vitamins are absolutely not covered by any of the insurance plans. And I have to charge them, but it breaks my heart because I have to purchase them separately and none of the insurances will pay for it. And yes, patients need to understand that even if those are the ones who are become bad doctors, the system has caused changes. I'm starting to worry because I'm a geriatric attending for young residents who are in training after medical school. And sometimes it breaks my heart because I can already see that some of them are just, their spirits are dying because they can see that they're going to not be able to serve patients in ways that they want to serve. And there's big bifurcation between patients and doctors nowadays. And I want to close that gap. And
mhm,
I
mhm.
think that we need to all come together and figure that out. But I think that maybe future medicine might be personalized medicine, where patients can reach out and personally just have relationship and take out insurance out of that. But that reform is maybe coming eventually.
We might need another episode just for that part.
Absolutely.
How can regular people get insurance and pay insurance when it is so expensive? So we will have to cover that in another session.
Yeah.
Dr. Kapadia, I have a question from one of the fans from Instagram. And this is the question. I'm just going to read it to you. He says, what do you do to get someone with a personality disorder to seek help if their disorder makes them feel like they don't need help?
Yes. So now thank you for asking that question. So I think the word personality disorder is also broad because when you ask the word personality disorder to a doctor, we are thinking not depression, not anxiety, not bipolar depression. We are thinking behavior that has taken 20, 30 years to develop. And then those are like borderline personality disorders or antisocial personality disorder. But I think that your fan might be asking that this person is very difficult. Maybe that's what she meant by personality disorder, or maybe the patient has on top of maybe having personality that's, maybe has OCD or something, obsessive compulsive,
Mhm.
but maybe on top of that, they have depression or anxiety or intermittent explosive anger bursts. And they don't think that they need help. And again, I think the way to do this is a loved one, first of all, have a conversation. You have to have a difficult conversation. If your father or your loved one was morbidly obese and they were having chest pains, you would have that conversation. So why wouldn't
Mhm.
you have that difficult conversation when it comes to you seeing that they need help? Probe it in a gentle way, probe it in a using I statements. Say, you know what, I feel pain for you because I see you like this and I love you.
Okay.
And I think that bring it up to go come together to the doctor's office. Come see me together.
That is truly a very good advice. I always think that it's easier to see life as a spectator. So you can always see from outside, but for the person that is actually dealing with those conflicts, especially in the case of that question where they don't think is any problem with them, um, it really must be really hard because
Yeah.
it's like seeing your family dying or in pain or destroying their life, right? They cannot get financially
Mhm.
successful, they cannot be happy. And it affects everyone else in the circle.
Actually, let me add to that. I do have screening questions in my office that I give. They're on mental health. They don't say mental health on top. They'll say something like PHQ-9 or mood evaluation. I give them one part of the physicals. I give them also when I do personalized consult with the patient. But maybe the person who asked you that question might find it helpful to bring this patient or get in touch with with me or another doctor like me where the screens can happen. So the patient has to answer these questionnaires And these questionnaires are very like specific. They'll say, do you not enjoy the things you used to once enjoy? And they'll ask you to grade it from 1 to 10. So maybe if you can get your loved one that you think is personality disorder doesn't really think they have an issue. Maybe when they answer these questions and then they step back, there's a scoring on the bottom. And then the doctor can say, hey, like you are having impairment in your life. And that could be another way to actually probe into that.
Well, thank you so much, Dr. Kapadia. It's really very refreshing to see you representing those doctors that really care for, caring for the people and making people feel better. And, instead of trying to always fix their symptoms or work in the symptoms, that you go and you see them as a whole, the body, the mind, and really try to, not to have them as patient your whole life. So that is really good.
I appreciate
Is there
this.
anything else that you want to add before we finish today?
I actually, this is kind of medical and mental, and then it's not. And I want to thank you for Rosa. I think people like you are trying to open a dialogue and bring people together. I think we have become very isolated as a society. And I think, yes, I think that will be my last remark. Us coming together, all of us, remembering that love brings us all, and sympathy and empathy for each other. I think that's another avenue of healing that we don't think about, but that's a natural antidepressant. I tell my patients all the time. So I think that, just even a platform like this, but many of you guys get off the phone, Rosa has, her book, or 60% of, I think, your book donates to people, right, who are in third world countries.
Well, right now we're doing 100% and more.
Oh,
Maybe at
wow.
some point it will be 60%.
Exactly. So I think that's wonderful. And I think that's part of the reason I'm also here, because I feel like the sense of giving is really absolutely, give each other a hug. Everybody give each other a hug.
Yes.
I think, say hello, how's everybody doing? I think that that's going to itself also lift us and bring us together and provide more wholesome care for everybody.
Well, my greatest gratitude, Dr. Kapadia, and best wishes to you. And if you want to make an appointment with Dr. Kapadia, you can find her at www.balancemedicalcare.com. Again, www.balancemedicalcare.com.
Yeah. And
coming up on Glasses Off with Rosa, we will discuss more topics on mental health, education, global warming, and much more. Please subscribe so you don't miss any of them. And remember, the power to bring constructive change is in our hands. So let's keep going. Thanks, everyone.
Have a good day.